Spotlight on America correspondent Angie Moreski. Shuttered pharmacies like this Walgreens are becoming an all too common sight in neighborhoods across the country. Nearly 50 million people nationwide, 1 in 7 Americans, live in so-called pharmacy deserts. We investigate what's driving this growing trend and what it means for healthcare. Empty marquees like this are becoming a sign of the times as more Americans are finding the local pharmacy they used for years suddenly closing its doors, including this Walgreens in Silver Spring, Maryland. When it closed, what was your reaction?
I was really mad.
My mother lives right here, so a lot of people in her building frequent this pharmacy, so it has been inconvenient for them.
Research from the Ohio State University found 1/3 of all pharmacies across the country closed from 2010 to 2021, leaving nearly half of all counties nationwide with at least one pharmacy desert.
This is both an urban and a rural issue.
Dr. Michael Murphy is an assistant professor of clinical pharmacy at Ohio State and shared exclusive preliminary results of OSU's ongoing research with Spotlight on America. It shows the trend of pharmacy deserts accelerating, with more than 7,000 pharmacies closing from 2022 to 2024 and 2,800 closing in just 2024 alone.
We're seeing a dramatic and frightening trend, which is that these closures seem to be increasing in prevalence.
Rural areas have the highest number of pharmacy deserts, with GoodRx research showing Alaska, North Dakota, Montana, South Dakota, and Nebraska with the most counties impacted. What is the biggest impact doctors are seeing with pharmacy deserts?
Frustration. Our patients are frustrated. Our providers are frustrated. Patients aren't able to get their prescriptions.
Dr. Colin Vanis is Chief Medical Officer with Doctor First. He says getting patients to take their medication is already a problem, so making it harder to get prescriptions filled can have dire consequences.
Their risk of readmission or increased morbidity or mortality or even death skyrockets.
Wow, death. You think this could literally lead to more patients dying?
100%. If you live in a pharmacy desert, you are more likely to have a heart attack, or you are more likely to be readmitted to the hospital. And it can all be traced back to adherence.
Beyond medication adherence, he says losing more pharmacies takes away a key resource for frontline preventive care.
You can get vaccines, you can get screening and screening labs. Some pharmacists even have the ability to prescribe.
Despite that important role, many pharmacies have struggled in recent years to maintain profitability.
Right now, the current pharmacy model is not sustainable, and that's why we are seeing more and more pharmacies close.
CVS, the largest pharmacy chain in the U.S., is on track to close 235 stores in 2025, telling Spotlight in a statement, store closure decisions are based on several factors, including population shifts, consumer buying patterns, and store and pharmacy density. Walgreens is on track to close even more stores, announcing 500 will shutter in 2025. And Rite Aid went out of business, closing all of its remaining stores as of October after 2 bankruptcies.
Some of us who live in suburbia perhaps and have access to multiple pharmacies might not have realized this is actually a phenomenon and a growing phenomenon.
Solutions being looked at to help bridge the gap in pharmacy access include greater use of mail-order pharmacies and telehealth options. But those don't work for every situation, especially when there's an emergency. For Spotlight on America, I'm Angie Moreski.